All right, before we get started, I just want to say thank you really quick to our panelists joining us today. I also want to say thank you for our attendees who are joining us virtually, and for those of you who have written in such thoughtful questions that are contributing to this discussion today. This discussion is particularly timely because it's following a recent CDC report that came out just last week. So in this report, it was a survey conducted to over 5,000 Americans, and it was surveying the impact of mental health and how the pandemic has affected this. So what they found was over 40% of the respondents reported experiencing at least one adverse mental health condition during the pandemic. So with that being said, I want to thank Congresswoman McBath not only for leading this critical conversation today, but also for all of your advocacy you've done on behalf of your constituents regarding mental health and your continued legislative work you do in Congress addressing mental health needs.
Thank you so much, Zibby. I really, really appreciate it. And thank you to everyone that's joining us today. So grateful to have all of you with us. We are indeed in some very, very difficult times, and just the additional added stressors of COVID-19, we know have added additional stressors on people all across the nation. And so we think that this conversation that we're having today is timely, and so grateful for each and every one of you and our panelists for being with us this morning. I am grateful to be with you virtually this morning. It seems to be that we're doing everything virtually now, but to talk about such a very critical and vitally important topic, which is mental health. And we know in challenging times like this, it's so important that we continue to gather with our friends and our family members and learn and really just kind of lean on our community to make it, to get by and to get through these very difficult times. And we need one another for support. At a time when it may not be so easy for us to safely gather or to spend time together or to be together in person, and we're relational people, human beings are relational. I'm just thankful for technology. I am very thankful that it's kept us close and kept us connected to one another and has allowed me to continue to be connected to each and every one of you. We're here today to talk about how COVID-19 pandemic has impacted people's mental health, their psychological well-being, and learn more about the resources that are available to all adults and to children for their mental health, as well as resources that are available for our community as we continue through the COVID-19 recovery. As we've entered the 6th month now of this pandemic, and sometimes I feel like it's even longer, I continue to hear from Georgians who are dealing with anxiety and anxiousness and anxiety during this crisis, during this time. They're uncertain about their jobs. They're uncertain about sending their children back to school, or uncertain about having to teach their children from home virtually. And, you know, they're very concerned about their own physical well-being. And I know that this weighs very, very heavy on their minds. We hear from constituents all the time. And so as we continue to observe our social distancing, which is absolutely a must, and we must follow all of the CDC guidelines and the guidelines of our healthcare providers. But that means we have to continue to do social distancing from our friends and from our families and from our loved ones. And we know that this really can take a toll on us emotionally. So feelings of social isolation and disconnection, they affect everyone. I was just telling my staff this morning, it's kind of like pulling my hair out. Like I keep thinking, you know, when am I going to be able to, you know, go spend time with family and to go really spend time with friends or to travel again? You know, we really feel somewhat isolated. And we just kind of feel somewhat disconnected from everyone, even though we have the ability to do gatherings socially through the internet. It's still not the same as that human connecting. But I'm really committed to doing everything in my power to protect the residents in the 6th Congressional District And we're trying our best to equip you with resources and tools and information to combat these very difficult times and to remain healthy and safe. Most people won't, I'm sure know by now that for me, keeping you safe and keeping you healthy is always foremost in my mind. As a member of the Mental Health Caucus in Congress, I'm working to get increased reimbursement to telehealth services by mental health providers and requesting that Congress provide funding for trauma-informed care initiatives during the COVID-19 pandemic. I'm recognizing that telehealth is an increasingly more important way by which our seniors and people that have pre-existing conditions or for whatever reasons are unable to get to their medical healthcare professionals. This is a very vital and important way for people to continue to really remain healthy and to get the care and the guidance that they need for their health. Ultimately, we are facing a shortage of mental health workers. And developing a stronger mental health workforce is primary. It's a priority for us, for my office, and I'll continue to push for extended funding, greater funding for mental health resources, and also for the mental health workforce. I'm also a founding member of the Freshman Working Group on addiction. I work with my really good friend, David Trone, who spends a lot of great time and effort among the freshmen and galvanizing support for opioid addictions and, addictions of that nature. So my colleagues and I, we recognize the need to address mental health and substance abuse needs in Congress. And we work very diligently in trying to appropriate funding. That's why I am a co-sponsor of the Mental Health Parity Compliance Act, which actually strengthens parity in mental health and substance use disorder benefits for people with insurance. I'm also a co-sponsor of the State Opioid Response Grant Authorization Act, which provides $1 billion in funding in the state opioid response grants each year through 2024. We passed 2014 already. I'm also an original co-sponsor of the Stopping the Mental Health Pandemic Act, which will provide $50 million in grants for behavioral health services. We're joined today by three phenomenal leading experts, Georgia's leading experts in mental health and substance abuse disorder. And they're going to share their resources and their tips and their expertise on how to maintain good mental health during the COVID-19 pandemic. I am joined by Emory University professor in psychiatry, Dr. Barbara Rothbaum, DeKalb County School psychologist Elena Works, and Beverly Ragland of the Georgia Council on Substance Abuse.
Hello, everyone.
After the presentations from our experts today, Zibby will introduce and moderate a series of questions that have been submitted by those that are attending. So she will moderate that portion as we answer questions pertaining to the concerns that you have. I'm very, very glad that so many of you have submitted your questions beforehand when you registered for this webinar. Thank you for doing that. Our experts and I, we will continue to do our best to make sure that we are answering all of your questions. And now I'd like to hand things off to Dr. Rothbaum for her presentation. And Dr. Rothbaum, thank you so much and take it away.
Thank you, Congresswoman McBath, and for your continued support of mental health needs. There is no one who hasn't been affected by COVID physically and with their mental health needs. So we're going to touch on some of that today and some tips. Obviously, this pandemic has produced so much uncertainty. Daily, we're faced with questions about how best to keep ourselves and our loved ones safe, how to make changes in our routines, and it's normal to feel stressed. I was just telling somebody the other day, I feel like I got to get my mojo back. Fear, worry, and uncertainty about your own health status, ones you love, is so common. Lizzie mentioned the CDC report that came out recently that said that Americans were 4 times higher depression and anxiety than this time last year. And it was especially notable in young adults, essential workers, unpaid caregivers, as well as minorities. And the CDC said support systems to address these mental health needs will continue to be needed urgently. When you're under stress, it affects your thinking, your emotions, your body, your behavior. So it's important to be aware of when you're stressed so you can help. So let's know the signs of stress. Thinking, being easily distracted, trouble concentrating, trouble remembering. Emotions, trouble relaxing, feeling irritable, feeling down, feeling anxious. In your body, increase or decrease of energy, body tension, feeling restless, sweating, being easily startled, having headaches, changes in appetite, difficulty sleeping. I've been hearing about a lot of difficulty sleeping. And in your behavior, if you're wanting to isolate, wanting to be alone, trouble completing your work task, blaming others, or getting into arguments. As Congresswoman McBath said, these epidemics restrict our access to social support, and we are social beings. We get so much, we need people. So schools, workplaces, places of worship, even spending time with friends and family. So we have to be creative about how to maintain these connections. Talking is easy. It's a little bit more difficult during a pandemic, and we really encourage talking to people that you trust is a really helpful way to reduce your feelings of isolation, anxiety, fear, boredom, or vulnerability. Seek support from family, friends, mentors, spiritual, religious leaders. You're going to have to be creative and flexible in accessing the support. So use your phone, email, text messaging, video calls. Feel free to talk about your experiences and feelings to loved ones and friends if you find it helpful. Some people find it helpful to write about their experiences and share them with others through social media or other outlets. There are a lot of blogs out there. Many people are starting new traditions, having virtual meals or group hangouts via video calling. Start a tradition of having a virtual happy hour with friends or colleagues. As we said, it's understandable to feel anxious and worried about what's going to happen. There's so much uncertainty. Make time to unwind and remind yourself that strong feelings are tolerable and they'll fade. Accept, don't try to suppress. Ride the wave of these strong feelings by observing how they show up for you and your body, and without judgment. Don't tell yourself you're being weak or a baby. Please be kind to yourself. I have recommended almost every day to patients, friends, and family members, reduce your exposure to the news. Constantly being bombarded by the news can get overwhelming. Pace yourself between stressful activities. Do something fun after a hard task. There are many ways to relax your mind and body, and you have to be very deliberate about it these days. Always practice slow, steady breathing. When you feel overwhelmed, you don't know what to do, breathe. Try muscle relaxation. Try meditation, yoga, exercise, walking, music, reading for pleasure. I'm doing almost all of those. I'm doing yoga online. I'm walking around my neighborhood at the end of the day. If I'm walking by myself, I'm listening to music and bebopping along. We've got a number of websites that I can share with you, and these are going to be available online, so you don't need to feel like you can grab them now. Congresswoman McBath's office is going to send these out, but they're meditation videos. Don't judge yourself. Really treat yourself and others with kindness and compassion. Everyone is under stress right now. There is no one who is unaffected by this. And people are likely to be more irritable. So as best as you can, try not to take things personally. Understand that this is hard for everyone. Treat yourself as you would treat a friend who's experiencing similar stressors, and that's with gentleness and grace and no judgment. Reach out for help if you need it. Allow yourself to grieve. Grief is a common response right now, but people grieve differently. Some feel angry, some feel sad, some may want to ignore their grief, and others feel all of these things at different times. I encourage you to try not to shove your feelings away, but try to find balance in your thinking. If you're scaring yourself and thinking about the worst case scenario, also try to think of the best case scenario. The chances are most of us are going to come through this okay, and it's important to remind yourself of that. Cultivate gratitude. I remind myself many times every day of so many things that I am grateful for. Develop a daily ritual with your family, your friends, your colleagues, to each share one thing you're grateful for every day. Write a gratitude list. Write down 3 things you're grateful for every day. Nothing is too big or too small. Maintain a sense of hope. Consider keeping a journal where you write down things that you're grateful for going well. Engage in and savor pleasant activities. With so much rain and Atlanta is so green, I appreciate when I'm walking around my neighborhood how lush everything looks. I think it looks beautiful. Search online for lists of pleasant activities within your budget that can be done at home. There are unhelpful ways to manage stress that I want to make sure we talk about as well. Some strategies that people use for managing stress may feel helpful in the short term, but they can have negative long-term consequences. So balancing the short-term relief from fear or anxiety and stress with monitoring the impact on your overall mental health. They showed in Manhattan after 9/11 that anxiety and depression increased and that all substance use increased. Over time, anxiety and depression decreased, but the substance use stayed high. So you really want to watch that. Reduce your reliance on tobacco, alcohol, and other drugs to manage stress and emotion. Constant worrying, thinking repeatedly, ruminating about the risk or negative consequences of COVID are not helpful. That is not serving you well. Co-ruminating, so worrying out loud with others and getting each other into a frenzy is not helpful. Impulsive or high-risk behaviors that reduce stress short-term are not helpful, such as excessive gambling or shopping or spending. You want to maintain your self-care and improve your sense of control and endurance. Social distancing can disrupt your routines and finances and your sense of control. So there's steps you can take to restore some balance. You always want to fuel yourself in a healthy manner. Eat healthy food. Engage in physical activity. It's probably more important now than ever. Accept circumstances that can't be changed and focus on what you can alter. Modify your definition of what's a good day to meet the current reality of the situation. Problem solve, set achievable goals. Work with your employer, landlord, utility credit card companies to reduce the financial stress if your income is impacted. Accept your unhelpful emotions and refocus your attention on activities that are aligned with your values. Maintain your daily routines and your schedule as much as possible. Continue to wake up at regular time, even if you're working at home. People make fun of me. I get dressed every day for work. I tell my husband I'm going to work now. It just means I'm coming down to my office in the basement. Increase your positive coping behaviors that have worked in the past. Shift your negative self-statements to statements that allow you to function with less distress. Instead of telling yourself this is a terrible time, try to change it. This is a terrible time, but I can get through this. There is a sign in someone's yard in my neighborhood that I love. Today I choose hope, and I remind myself of that every day. I also like the statement from mindfulness, everything is as it should be right now. So it's chaotic. We're in a pandemic. Everything is as it should be right now. The emotional impact of a crisis can depend on many factors. It also depends on how you were before the crisis. If you had pre-existing mental health conditions, then you might need to contact your mental health provider. And some of these resources might be helpful. And again, Congresswoman McBath's office is going to send these out to people who registered. I'm just going to flip through them very quickly, but they're all wonderful resources. Some are national, but they also offer local resources by county, and national ones that also will refer you to local resources. This is a self-care tips for stressed parents. Another thing I'm grateful for is my kids are bigger. Veterans, and especially post 9/11 veterans within Georgia, can reach out. We have the Emory Healthcare Veterans Program. Everything is offered at no cost to the veteran. We have an intensive outpatient program where people can come to us for 2 weeks. We also offer it virtually for people in Georgia, so they can get all of the same services virtually without leaving their home. We offer skills training and family relationship management. We have individual and group sessions, telemedicine. For people with cognitive impact, we also offer cognitive and neuropsych assessment and treatment, sleep assessment and treatment. We treat PTSD, mild traumatic brain injury, PTSD from military sexual trauma, depression, anxiety. We have a TBI track and a substance use disorder track. And if you want to reach out to us at the Emory Healthcare Veterans Program, this is how you contact us. And I turn it back over to Congresswoman McBath. I'll be available for questions, and thank you so much.
Well, thank you so much, Dr. Rothbaum. I really appreciate all the insight and wonderful resource information. Thank you so much. And next, we are going to hear from Alana. Alana, take it away.
Thank you for having me, Congresswoman, to talk about such an important topic. My name is Elena Works, and I'm a school psychologist for DeKalb County School District. I feel very honored to speak about such an important topic, especially because I work with a lot of school-aged children. I want to speak about how COVID-19 has affected this population. So for this presentation, I want to, for this presentation, I want to talk about what we know about kids' mental health, the effects kids have on being quarantined, recommendations to help our youth, and some resources. If you can go down to the next slide. Okay, according to the CDC, mental health is an important aspect of our health and our well-being. It includes emotional, psychological, and our social well-being. It plays a role in how we think, feel, and act, and it also helps determine how we handle stress and life in general. Mental health is very important at every stage of life. Next slide. Okay, so please keep in mind these statistics were reported prior to the current pandemic that we're all dealing with, as reported by the National Institute of Mental Health and the CDC. It's estimated that 49% of adolescents have a mental disorder, with 22% of that being a severe impairment. Some common disorders that we're seeing in the school system include ADHD, behavior problems, anxiety, and depression. So currently, about 9% of children have a diagnosis of ADHD, with 7% having a diagnosed behavior problem. 7% of kids are experiencing anxiety and are diagnosed with it, and 3% have a diagnosed depression disorder. I do want to make note that I think these numbers are probably a lot higher. There's lots of factors that prevent kids from getting the diagnosis that they potentially need. And I do believe these will get higher when we get some new data. Next slide. It's also important to know that age and poverty level also affect a person's ability to receive treatment for these disorders. There has been some current trends. Depression and anxiety have steadily increased over time. And we also notice that depression and anxiety increase the older kids get. So I may not see it as high at my elementary schools, but I'll see it more at my high school level. Next slide. Okay, so in March of 2020, schools all across the states began closing their buildings. The decision was unforeseen by many, and it was, of course, done to implement safety for everyone involved. The COVID-19 pandemic has been described as a collective trauma that impacts school-age children and their families in unexpected ways. And also, I'd like to add, it does have an effect on teachers, administration, and school psychologists like myself. Next slide. Okay. So as the world shut down, we all started to feel the effects of quarantine. Financial loss, with employment being the highest that it's ever been in my lifetime. Employees like myself receiving pay cuts. There's been a lot of fear about getting sick or getting someone else sick, like my parents. Lots of boredom, which for me resulted in way too much TV. Feelings of isolation, being frustrated from the information that I was receiving from health authorities, and maybe a lack of transparency. Another thing I've noticed is I have never washed my hands as much as I've had in the past few months. So I think we're all feeling effects in different ways. Next slide. Okay, so of course these effects can also be seen on our children. Nationwide, about 188 countries closed their schools, and that impacted about 91% of learners. Another big concern we saw is a lot of children rely on school lunch. So about 22 million children rely on school lunch for at least one meal a day. Some other concerns that we all have heard about is home stress. Parents are very stressed. Domestic violence continues to increase, and this trauma is being seen by our kids. Not every child had the same access to virtual learning. It happened very quickly, so not every system may have been prepared. Not every teacher may have been prepared to go to that outlet. Lack of financial resources impacts someone's internet capability, or if they had a laptop. So there's some other concerns that we saw for our kids. Next slide. So of course, all those can have some major psychological effects on our school children. And these are some of the things that we need to be on the lookout. Are kids now having difficulty eating and sleeping, and that wasn't a concern before? Do they seem more compulsive or depressed? And it also is important to note that people who already had these preconditioned mental disorders, it's going to be more heightened now given what's going on. Next slide. Okay, so my district, DeKalb County, we did anticipate seeing a variety of concerns as school begins this week. So my department, the school psychology department, as well as other departments, started to put together things to help kids once school starts back. We anticipate seeing a wide range of reactions. Some may have no concerns. We anticipate seeing some academic backslide, social challenges, emotional concerns, as well as behavior difficulties. Next slide. As far as academic backslide, that can plainly just occur because of varying home support. Not every parent is able to monitor their kids going online. Also, virtual learning takes a lot of intrinsic motivation that not every child has. as well as inconsistent teaching. So we are aware that some kids may have developed some gaps that we'll have to address this school year. Next slide. We are also aware that new social challenges may occur. Kids that were never clingy before now are very clingy, or kids may be starting to withdraw more. These are some things that we're anticipating may occur. Next slide. Many children are feeling grief over loss of loved ones, grief over people they have heard have passed away, or just kids grieving from canceled events, prom, graduation, and something as simple as saying goodbye to teachers and friends. A lot of our kids weren't given these opportunities, and they may still be grieving because they may still be affected by that. So all this can affect a child's emotions. Next slide. We are also aware that some kids may demonstrate a lot of behavior concerns, trouble sleeping, trouble eating, being more irritable, as well as some kids may demonstrate self-harm behaviors because they're having they're having difficulty coping with what's going on. Next slide. Okay, so prior to the fall, my department, headed by Kimberly Franklin, our coordinator, we decided to start having the conversation in the spring about how we were going to help kids come the fall. So we started to put together several in-services to help get out the information about mental health and mental illness and what to look for. We continue to consult with both parents and teachers. Last year, we did a lot of work with one-on-one mental health support for staff. We noticed that teachers were having a very hard time coping with these demands that were put on them, as well as, the stress of not seeing their kids. We also offer small group counseling as well as individual counseling. All the counseling plans that we develop kind of fit into the framework that all DeKalb County school students are getting with social emotional learning occurring throughout the day. And a social emotional learning for DeKalb is going to consist of self-awareness, self-management, social awareness, relationship skills, and responsive decision-making. Next slide. Okay, so now I just want to offer some general recommendations for all of us. The biggest thing, and we spoke about this before, is just showing empathy and patience, understanding that the children's experiences can be unique from our experiences. Calmly set limits. I know for myself, once this happened, I found myself watching the news all day long, and as an adult, that's not good for me, and it's not good for children as well. So setting limits on times that they're in media attention or are like absorbing what the media is saying. Assuring safely, simply just adhering to CDC guidelines about how we can keep our kids safe, and providing age-appropriate information. It would not be appropriate to explain COVID-19 the same way that you would to a 15-year-old to a 5-year-old. So just being cognizant of the information that our kids are hearing. Next slide. Okay, and then some general recommendations. It is important to know that every child's not the same, so each child will have very different experiences. So allow the child to feel what they are going to feel. Allow them to mourn over things. If the child wants to mourn over not having prom, although, in whatever the feelings you feel about it, allow the child to have that ability to mourn and feel what they're supposed to feel. Listen and validate their feelings. Just being an open ear for a child to talk does wonders. And lastly, it's really important to avoid telling our own stories. I know usually we think it makes children feel better when we can try to relate to them, but let's just make it a time where they can talk to us and we're just listening. Next slide. Okay, and lastly, I did provide some resources for both parents, teachers, as well as students. There's a lot of helplines that you can talk to in a case of an emergencies, and some of them, like crisis text line, you can simply just text, and that kind of helps to facilitate a conversation for kids that are having a really hard time coping. Next slide. And thank you so much for this opportunity to relay this information. And I'm gonna send it back to you, Congresswoman.
Thank you so much, Elena. I'm so happy, and thank you so much for sharing all this great resource information once again. I'm just really encouraged by how much help and support there is. And I'm glad that you're being able to express that to all of our participants today, because sometimes we have a sense that we're the only ones that are going through these emotions and, these feelings and these anxieties, and, everyone in some shape or form is all going through the same thing. So thank you so much, Elena. I really appreciate it. Finally, we will hear from Beverly Ragland with the Georgia Council on Substance Abuse. Thank you.
Good morning. It is such a pleasure and such an honor to be here. Thank you for inviting me. Today, I'm excited to share about recovery resources. I'm Beverly Ragland, the program manager for the Georgia Council on Substance Abuse Care's Warm Line. And I'm going to share a little bit about that in just a moment. But first, I'm going to share a little bit about myself, because for so much of the work that we do at the Georgia Council depends upon connection. We believe at the Council that connection is the opposite of addiction. So when I say that I'm Beverly Ragland with the Georgia Council on Substance Abuse, I'm a person in long-term recovery. And what that means for me, it's been over 21 years since I've used drugs and alcohol to deal with my depression, anxiety, severe grief disorder from my son's transitioning in 2013 and 2015. I live my recovery out loud because I believe in the benefit of sharing my recovery experiences to help others to seek long-lasting quality recovery. And my recovery has afforded me so many things. I'm present for my family, church, and community. And I talk about myself when I'm speaking because it's important to help everyone to understand that at the Georgia Council and on the CARES Warm Line, we have recovery coaches that are dedicated to enhancing connection with their lived experience. So if we'll go to the slide with the little girl with the smile. That's me. I was an Army brat. I'm a daughter of a veteran. And that's when I was in Germany. And it was like 60 years ago, to be honest. And at that time, I thought our life was paradise. We went on family outings and I was in Sunday school. We had family dinners and everything was wonderful. You could say it was paradise. But then there were these dark times. Being the child of a Vietnam and Korea War veteran, my father had unresolved PTSD, and he had anger outbursts because of the situation. You're preparing for war. And so those were the storms in paradise. If we can go back to the slide with my name. So that's me. After serving with my dad for those years, I decided I would join the military myself. I'm a service-connected disabled veteran. And when I joined the Army, I joined the all-volunteer Army. At that time was the Vietnam era, and drugs and alcohol were prevalent. I mean, it was just a way of life in the military. And that compounded with the scars of my childhood, eventually my life plummeted out of control. When I got out of the military, I went to the VA, and that's where I was afforded so much help. I went into therapy, I had groups, and I was given medication in order to control my illness. I was the product of what was going on in my life, and being an Army brat and being a veteran. So I eventually became so grateful for getting recovery at the VA that I dedicated 20 years of my life thus far to behavioral health supports. And that brought me to the point where now I am currently with the Georgia Council on Substance Abuse. And if we'll share that slide, please. At the Georgia Council on Substance Abuse, the mission is to increase the impact of recovery in our communities through education, advocacy, training, and peer recovery supports. That's so important to remember because as a result of that, the council facilitates and connections and conversations among people combating the discrimination faced by individuals and families confronted with substance use challenges and disorders. We do this to save lives and to bring hope, joy, and happiness, and to increase and create a world where recovery is promoted, valued, and sustained. So what I was blessed to do is to be the CARES Warm Line manager. If you'll put the slide up with the CARES Warm Line phone number. Let me tell you a little bit about the Warm Line because I really want to talk about this wonderful support for anyone, whether it be a peer who is new in recovery, old in recovery, whether it be a family member, a community ally, someone who is just curious. They have the opportunity to call the CARES Warm Line, and you can call or text and from 8:30 in the morning to 11 p.m. at night. One of the other opportunities that we have on the CARES Warm Line is that we support virtual all recovery meetings 7 days a week, one at 10 in the morning and one at 7 in the afternoon. And of course, these are all recovery, whatever, it doesn't matter what you're in recovery for, you can call and get support on that virtual meeting. The recovery coaches on the Warm Line, they also do personal weekly check-ins and they're dedicated recovery coaches. So if you want a dedicated recovery coach that calls you once a week, you can get that to the CARES Warm Line. It's important to know that the recovery coaches on the Warm Line, they're in recovery from substance use disorder, and they carry a message of hope. Freedom from addiction is real and available to all. And on the Warm Line, we support long-term recovery, we promote wellness and self-directed care with no judgment. It doesn't matter how you're trying to get well. There's no judgment there. We support you in your pathway. We build on abilities, resilience, and strength. And we advocate and celebrate, again, all pathways to recovery. The recovery coaches listen, offer encouragement, validate, and empathize. It's important to remember we care. And again, the Warm Line is answered by recovery coaches with long-term recovery. They support you. This time, and if you want to know when to call, the next slide, please. You can call or text when you're struggling and need someone to talk to. You know, so many times when I was in my recovery and I was early in my recovery, my family did not want to hear a thing that I had to say. They had heard it all. You can call the Warm Line when you just need someone to talk to, when you don't want what you say on corner A to get to corner B and C. You can call and there'll be a confidential conversation there. We believe in the mutuality of peer support. So when you call, you can share triumphs and challenges also, so the recovery coaches can be uplifted as they uplift you and help to celebrate those triumphs and to support you in those challenges. The warm line is there when someone's feeling lonely, depressed, or has experienced a setback. And that is so important in this time of the pandemic because we're isolated, and so loneliness is prevalent, and depression, and there's so many opportunities to have a setback, to go back to using drugs and alcohol. And we're here to support you as you work your way back to wellness. When nobody understands, there's an opportunity to talk to a recovery coach on the warm line. We're here to listen and answer questions about recovery. So it's just so important. And, you know, as I said, I share my lived experience because first of all, I don't know how many veterans are on this line, but I do understand the challenges of being a veteran, of growing up in that environment, and then having to come back into the real world and not be accepted. So please call the CARES Warm Line, and the number will be available. And the other important thing is every resource that you saw today flash by, the recovery coaches can connect you to those and others. Thank you so much.
Well, thank you so very much, Beverly. We really appreciate that. And thank you for all the wonderful work that you are doing and just helping people to stay healthy and whole. And you're doing that in a very organic and holistic way. So thank you very, very much for that. And now I believe we have some questions from our participants. And I believe that everyone will have a chance to at least be able to answer one question.
All right, so we're going to keep this a little bit brief in the interest of time, but Congresswoman, I want to start off by asking a question written from one of your constituents to you. So this constituent writes, this pandemic has made it very difficult for behavioral health organizations to remain open. What is the Congresswoman doing to ensure that those of us with substance use disorders have access to treatment and can continue our monthly meetings?
Well, thank you so very much for that question. And, you know, I understand that there are very many organizations that primarily treat individuals with mental health and or substance abuse disorders that are at risk of, you know, closing their doors because of the result of COVID-19 and the pandemic. In order to ensure that our behavioral health organizations have the funding that they need, it's imperative that the federal government continue to fund these organizations, most specifically at a time like this. And I've been really happy to be able to sign on to pieces of legislation and also letters that my colleagues and I have put forth in regard. I just recently signed on to a letter led by Representatives Kennedy and Matsui and Tonko, along with Senators Warren and Mackey and Murphy, and to the House and Senate leadership to request that at least $38 billion in emergency funding be allocated for behavioral health organizations. As I said earlier, and as we've already substantiated on this call, you know, that this time right now, mental and emotional care or psychological well-being is extremely crucial. And so we wanted to make sure that we are still appropriating funding to make sure that people have access to these resources to remain whole and organic as much as they can during the pandemic. I also joined a letter to the Secretary of Health and Human Services, actually requesting immediate guidance to providers on how they can put forth more telehealth services. As we talked about before, telehealth has been a very crucial way which people have been able to continue to get the help and services that they need. But also just making sure that people are able to continue their treatment on, through telehealth as well during the coronavirus, this public health crisis. I'm continuing to work to ensure that, making sure that we are continuing to provide mental health services within our district, within our community. And we work very, very closely with our healthcare providers, all within the district, just finding out what their needs are and how we can, really allocate the funding to help these programs and these policies continue. So I'll continue to work as hard as I can to build out funding for mental health and psychological health. And you can count on us to do so, because as I said earlier, what I think about every single day, and my staff knows, what I think about and what I worry about every single day is your emotional and physical well-being.
All right, thank you for that, Congresswoman. Our next question is to Dr. Rothbaum. So we know from the CDC data that certain age groups are being hit harder by the pandemic in terms of their mental health, specifically the age group 18 to 24, so young adults. We have a constituent, Lisa, who's writing in along these lines. Lisa's asking, what can be done for kids between the ages of 18 to 21? As a parent, I feel my hands are tied. I see my child spiraling, but can do nothing.
Thank you, Lisa, for that question and recognizing the difficulty that your child is going through. I'm going to share my screen, if we can do that. And I've got some other resources. So the Georgia Crisis and Access Line, and here's the number. This is a wonderful resource for everyone. It can be one-stop shopping. People can call in, tell them the county that you're needing services. If you have insurance or if you don't, they'll give you options. Typically, they'll stay on the phone until the appointment's made. They handle crises and can help with routine and crisis care. So this is a wonderful resource across Georgia. For young adults, if they attend college, then the Counseling and Wellness Department can be a good resource. SAMHSA has a national helpline in Georgia and nationally. And again, Congresswoman McBath's office will send these out. There are a number of support lines. Kids love to text. We've also got text lines and online chats. 7 Cups is a good one for emotional support that's affordable therapy. And Emory has some age-specific wellness guides. And I also got to say, thank you, Congresswoman McBath. I am grateful every day that you are representing our needs and recognize the mental health needs of Georgians and you're fighting for us. So thank you so much.
All right, our next question is for Beverly. Many in the recovery community rely on in-person support, such as AA and NA group meetings. Now that we're in an era of social distancing, are virtual group meetings available for people to attend online? And where can we find these resources throughout Cobb, Fulton, and DeKalb?
As I mentioned, the Georgia Council on Substance Abuse Care's Warm Line supports 2 virtual all recovery meetings on a daily basis, but also the recovery coaches on the Warm Line have an extensive resource database, and you can just call and say what your zip code is, the type of meeting that you're seeking, and they can give you that specific information, not only for the virtual recovery meetings, but also any other recovery supports that you need. And I want to mention our recovery community organizations. There's 30 throughout the states, and those are opportunities, though, with the COVID-19, you have to call and let them know you're coming so that they can be in compliance with how many people can be there at a time. But it's an opportunity to physically connect with peers and those that are in recovery. Again, those recovery community organizations also have virtual meetings. And if you call the Warm Line, they can tell you specifically where you can go or where you can connect with virtual recovery meetings.
All right, I'm so sorry. We are running short on time and need to close out, but if we didn't get to your question, we will follow up with you. Thank you so much again for submitting those. And thank you again, Congresswoman, for hosting this event today.
Well, thank you so much, everyone. I really appreciate you taking the time to participate with this morning. Participate with us. I hope that the information that you've received has been insightful and informative. Please, as Zibby said, please continue to reach out to our office at any point in time. We are here to serve you. You can reach out to us if you have any specific questions or needs. Our Sandy Plains office number is 470-773-6330. There will be a recording of today's webinar. If you choose to make sure that people in your community or family and friends might have access to this insightful information and phenomenal group of women that we've gathered this morning, please feel free to reach out to us. And of course, all of our attendees, we will, all of you that have actually registered, we have your email address, so we have a way to find you. But thank you once again. Thank you so much for your incredibly insightful questions. Thank you so much to our panel. Thank you for everything that you do to keep us whole and healthy. And everyone, please stay healthy, stay safe, and have a great week.